Now that you have some idea of what depression feels like to your loved one and your role as a caregiver, let's talk a little bit about what can cause depression. Depression is a form of suffering that cannot be summarized into one encompassing cause. There are many things that can cause depression, and many contributing factors may be involved. So, as a caregiver, don't rush into putting a label on any one answer or solution. Be open and willing to work with your loved one as you seek to find the root cause and the best course of action to help them move forward toward freedom. There are two distinct categories of depression: clinical depression and situational depression. Clinical depression, generally speaking, is a broken network of the brain's function caused by chemical changes or hormonal imbalances in the brain. Situational depression, generally speaking, is caused by circumstances and the environment we live in. For example, trauma or a life-altering event such as the loss of a loved one, a tragic accident, loss of employment or financial debt, poor health, chronic illness, obesity, poor diet, and lack of exercise and or sleep. Repressed and unhealthy emotions such as unforgiveness, bitterness, jealousy, envy, wants, which stem from comparison, anxiety, fear, discouragement, and physical weakness. All these things can play a role in causing depression to surface. We can generate depression with negative self-talk or receiving negative words that are being spoken over us from others. Depression can be seasonal. Certain seasons or holidays or certain times of the year can trigger feelings of depression. Depression also often has a spiritual component. For example, what they are experiencing could be oppression, which is spiritual attack from the enemy. Oppression can feel like depression because oppression has many of the same characteristics. Depression is not necessarily the result of a lack of faith, but like all suffering, it has a way of getting us to question God, His love, and His goodness, and that flawed view of God affects us. As a result, a depressed person often pulls away from God instead of running to God with the pain. This separation from God only causes the depressed person to feel worse. When trying to determine the type of depression, whether it is clinical or situational, and its root cause, do not let the word depression or a clinical diagnosis keep you from seeing the bigger picture and the ordinary problems of ordinary humanness that may be hiding beneath the surface that are feeding the depression. Bottom line, depression has a root, and many different factors can be feeding into or triggering that root cause. But once the root of depression is identified and exposed, it can make it easier to see the source of the depression and the best course of action for you and the one you love.